Good afternoon. My name is Steve Hernandez, and I'm the Executive Director of the Legislature's Nonpartisan Commission on Women, Children, Seniors, Equity, and Opportunity. Today, we're here to host a roundtable discussion on gun violence intervention and prevention to present the final report of the Advisory Committee's work that really occurred over the past few months here in the state of Connecticut. As many of you may recall, under Public Act number 2135, the state of Connecticut established a gun violence intervention and prevention advisory committee for the purpose of advising the General Assembly and the people of the state on preventing and intervening in gun violence. Also to coordinate the funding and implementation of evidence-based, community-centric programs and strategies to reduce street-level gun violence in the state. Today, we will be discussing the results of that report and the recommendations that were brought to the legislature. We're so honored today to be joined not only by the chair of the task force, but also the chief administrator, Dr. Pina Violano, who served on behalf of the commission, which was tasked to administer the task. And of course, the lead and the spiritual lead, but also the champion of this work, who joins us here today, Marilyn Moore. Senator Moore, I am told that you attended every, if not almost every meeting of the task force, and we so appreciate your advocacy. We're also joined by the esteemed Senator Gary Winfield, Representative Robin Porter, and Representative Jonathan Steinberg, who will be joining us as a responsive panel later on during the discussion. But Senator Moore, I'd love to welcome you, not only to introduce yourself and your efforts around this work, but also to introduce our esteemed chair and our chief administrator. Welcome, Senator Moore.
Thank you. I want to thank, first of all, thank you all for being here, but from my heart, I want to thank this advisory who dedicated so much time, not just in the meetings, but the work they did behind the scenes, the investigative work, the deep dive that they did in looking at every possible situation and including the voices from all the communities, both from urban centers to legislators to people who have been doing the work. I think it's really important that all the voices are included when you're coming to a decision that's going to impact the whole state. And we were blessed to have an administrator who understood the task, but who had been involved in this type of work prior to this. And then to have a chairman, Mr. Woods, to lead this, it's a blessing all the way around. I believe we did a very inclusive job of making sure the right people were at the table, the wrong people were at the table, and gave everybody an opportunity to have some say in this. And the time and energy put into this, I think it's a comprehensive plan. So I want to thank Mr. Woods and Ms. Pina for the work that they did. Thank you. And Stephen, I'd be remiss if I didn't thank Mary Abrams, Senator Mary Abrams, who gave us the opportunity to put this in Senate Bill 1, which was Senator Looney's bill, which says that it's very serious and it's intentional that this work get done. And I appreciate the support that we had during the session to get the bill passed. So thank you.
Thank you, Senator, and thank you for that. Thank you for noting that Senate Bill 1, which was really the hallmark of the Senate's work in this last legislative season, really underscored not only the importance of this task, but also the importance of the recommendations that have come from the work. So thank you for that, Senator Moore. I'd like to now pass the baton over to our esteemed chair, Chair Andrew Woods.
Well, thanks everyone for the invite. It's really an honor, one, to have gone through this process with so many dedicated people who have been doing this work across the state of Connecticut, but also many of our national partners that made a contribution and continued to stay the course with us over that 3-month period of time. It's been a pleasure working with, obviously, both Pina, TJ, yourself, Dr. Stephen Hernandez, but also Senator Moore. It's been a pleasure working with you and taking those calls in the late evenings to help me sort through some of the challenges that we're also facing. But I think, we really had a lot of good people to pull on, and it resulted in such a report. So looking at the agenda, I want to turn it over to actually Pina Violano, who was and still is apparently the administrator of this particular effort. And we'll take it from there in terms of our presentations and then go from there with the Q&A. Pina?
Great, thank you, Chairman Wood, and thank you, Senator Moore, Stephen, Senator Winfield, Representative Porter, and Representative Steinberg, and TJ. Good afternoon, and thank you for this opportunity to discuss the processes in which the advisory committee took together materials and findings for the final report. I'm going to pop up my slides here. Is everyone able to see them on your end?
Yes.
All right, perfect. So as Chairman Woods and Stephen and everyone's mentioned, I was appointed as the advisory fellow and the primary administrator for this committee. From the pre-work, I'm going to take you through from start to finish of what the things that we did in the processes. So first, it took obviously putting together the committee itself, and folks were appointed from June 21st to September 17th. Myself being appointed as the advisory fellow and primary administrator on August 19th. And Chairman Woods appointed on the 13th of September. We had our first strategic meeting with Stephen Hernandez, our executive director, and Senator Moore, and on the 16th of September, and our first inaugural meeting started on the 29th. So pretty quick timeline getting things started once we were actually all appointed. Here are the appointed committee members. If you have not seen them before, Deborah Davis from Mothers United Against Violence, Dr. James Doddington representing Yale New Haven Health, Ebony Epps from Street Safe Bridgeport, Dr. Kyle Fisher, the Javi, our Health Alliance.
Yeah, Pina, could you hold on 1 second? I think
Certainly.
we're not seeing the slides on our end.
We're going to try and share the slides again.
Okay,
Thank you.
I'll try doing it here.
There we go.
You got it
There
now?
you go. Thank you so
Here we
much.
go.
That's perfect.
Okay, sorry about that. And let's see if I can move this out of the way so we can pop it back up onto this mode. Okay. Can you see them there?
Yes, we
Okay.
can.
All right, perfect. So as I mentioned, Deborah Davis from Mothers United Against Violence, Dr. James Doddington from Yale New Haven Health, Ebony Epps from Street Safe Bridgeport, Dr. Kyle Fisher from the Javi, Leonard Jihad from Connecticut Violence Intervention Program, Dr. Charles Jandro from Hartford Hospital, Glenda Lewis representing Project Longevity, Michael Makowski from Connecticut Department of Public Health, Jacqueline Santiago from Compass Youth Collaborative, Carl Schitzel from Connecticut Hospital Association, Dr. David Shapiro from St. Francis Hospital, Dawn Spearman from You Are Not Alone, Jeremy Stein from Connecticut Against Gun Violence, Colleen Violette from Connecticut Department of Public Health, and of course, our esteemed Chair Andrew Woods from Hartford Communities That Care. The administrative staff consisted of Thomas or TJ Nuccio, who was our policy analyst and our administrator, and myself as the appointed fellow and primary chair. And as Stephen mentioned, we were the administrative staff of the commission to serve on Public Act 2135 as it stated there. The steps that we took, the committees, we had 7 committee meetings. First one was on the 29th of September. We had a data presentation the following month on the 15th of October. Subject matter experts, we included 3 presenters on the 12th of November, and I'll explain to them in the next couple of slides what they talked about. Subcommittee reports were given on the 23rd of November. The first draft of the executive summary presented to the entire committee on December 15th. The formal committee vote to approve the final report took place on the 22nd of December, and a final committee adjournment took place on December 30th. So pretty fast moving for us here. All of the meetings, as this one is, are being recorded for CTN Live, as well as the our CWC SEO Facebook Live. We established, knowing that we had only 90 days to do all this work, we quickly broke out and established subcommittees in 3 areas that we thought were really needed for us. We had an evidence-based program and research that were led by these tri-chairs, excuse me, of Carl Schitzel, Jeremy Stein, and Jackie Santiago. My apologies, sir. Policy and funding that were led by Dr. James Doddington and Dr. Kyle Fisher. Community engagement and public health from Deborah Davis and Michael Makowski. And knowing that we had to move quickly, we sought assistance in writing and editing the final report from someone that was worked well with our chairman at Hartford Community that Care. Ken Ashworth was a volunteer research assistant. Sorry, apologize here. We, as Senator mentioned here, Warren mentioned, community voices were really important to us. And so we held 2 public hearings, one first on November 5th that focused on getting firsthand lived knowledge and experience and input from our public safety folks in the state. We had 14 that gave oral testimony, 4 with written testimony. We followed that with a second public hearing for the general public on the 17th of November, where we got 47 oral testimonies, including youth in those, and 26 written. And they overwhelmingly, what we kept hearing from the communities, that there should be an established commission on gun violence intervention and prevention to coordinate the funding and implementation of evidence-based, evidence-informed, and community-centric programs and strategies. Excuse me, to reduce street level gun violence in the state. Sorry. We also took time to hear from our youth who were critical in helping us to understand what they face with violence and some of the solutions that they thought would be helpful. We heard it from the 3 major cities that are affected by gun violence in our state, Bridgeport being that one of our committee members, Ebony Epps from Street Safe Bridgeport, held a community forum that was with youth on the 29th of November. And our report shares all of those points that the youth put in and gave us great information. So you can read those in detail in the report. From the Hartford folks, the Greater Hartford Youth Leadership Academy at the Hartford Communities That Care, youth use a problem-solving framework to study their exposure to gun violence, and then to also build on their recommendations of preventing gun violence as they see it. In New Haven, we had a couple of things. We had the comments shared by Sean Reeves, who is a co-founder of Sport Academy, and he's also a community activist in our city. From youth who attended one of his academies. He uses chess as a means of getting through to youth. Excuse me. And they give actually sets of chess away. And anybody who's come to those events, as well as folks that of a community garden that he's created in Newhallville, provided comments, and those also are shared in the main report for details there. And our own esteemed representative Robin Porter here shared some observations of an event that she was an invited guest of Trell Morrison, which is from Daniel's company youth leadership mentoring program that was held at Wilbur Cross High School in New Haven. And it also included multiple other schools throughout the New Haven district. We also sought out collection of data from state agencies. There was a written request from Senator Moore and Chair Woods through the Department of Children's and Family, the Department of Public Health, from the Office of Finance Analysis and the Office of Legislative Research. And we also, one of our committee members also requested that we look into what maybe something that might have been helpful to our group too, from the Police Transparency and Accountability Task Force. So you'll also find some of those pieces of evidence that we collected from them in the final report. We pulled in subject matter experts from both locally and nationally. We had a Connecticut specific data presentation that took place on October 15th from our epidemiologist from the State Department of Public Health. We looked at Connecticut violent death reporting system and the homicide victim ontology in Connecticut from 2015 to 2021, knowing that the numbers for 2021 were not totally complete. But just to give you some quick numbers here to tell you, which I know all of us, I'm preaching to the choir here, of what the effect is of gun violence on us in the state. So we had at least 559 people that were victims of homicide between 2015 to 2019. We found that during the pandemic from 2020, there was 157 homicides, and 76% of those homicides were committed with a firearm. And then we know that 70% of them affected Bridgeport, New Haven, and Hartford. And 65 of all of those homicides were African-American. And we know that about $430 million in measurable costs occur to Connecticut each year based on these numbers. We had subject matter experts also give presentations on the 12th of November. We pulled in actually our own committee member, Dr. Kyle Fisher, who's the policy director for the HAVI. He talked about new funding opportunities in violence prevention and intervention. Greg Jackson, who's the executive director of Community Justice Action Fund, talked about conversations of our effect to end gun violence. And Aswad Thomas, who actually was a Connecticut resident, and I want to move my little areas here, who is now the National Director for Crime Survivors and Safety and Justice. And he talked about supporting crime survivors and what we could do better at. The timeline that we took, as I mentioned, was 90 days. It was action-packed. We moved like lightning on these. I'm trying to move my slides here, sorry about that. We had the first full draft to the advisory committee members on the 12th, or the 10th of December. Their official vote to accept the final report and send it to the joint standing committees of the General Assembly took place on the 22nd of December. And then the official adjournment and termination of the committee took place on the 30th. And that same day, we sent the actual final report to the co-chairs of the Connecticut General Assembly, Public Health and Human Services Joint Standing Committees. And on that same day, we also uploaded it and placed it on the Children's Women or the Commission of Women's, Children, Seniors, Equity and Opportunities website. And that's it, quickly in a nutshell for us here. And I'm going to turn it back over to Chairman Woods.
Hey, thank you very much, Pina. Great work as always. And while you're switching over, I'm going to switch on and share my screen with the recommendations that came from our committee members. So give me 1 second here. There we go. Okay, can everyone see the screen? I mean, okay. Is that up there?
Yep.
Okay, fantastic. Okay, we've already covered the bill, the law, that established the commission, and certainly the primary objective of this is really the question around whether or not there should be a commission on gun violence, prevention and intervention. And again, to support and secure and coordinate federal funding, philanthropic dollars to provide funding and support for training, monitoring for violence intervention field, as well as at the local and state level. And so that question has been our key question, and our key recommendation is to do exactly that. So, but where does that go? One of the big questions emerged out of our conversation on exactly where should it be placed. One thought was OPM, a thought was another agency, but ultimately we settled on the Department of Public Health, or at least for the most part, which has the regulatory authority, as we understand it, to address violence and injury prevention. DPH, as it relates to this particular work, currently doesn't have the capacity or doesn't have the resources if you will, or historically to actually take on an undertaking such as this, but we believe that there are some low-hanging fruit that actually could support it within DPH. So give you an example. Just recently, in the last couple of weeks, OPM transferred the governor's $3 million that he had inside the ARP, American Rescue Plan, that he committed to violence. Those funds have now been transferred from OPM over to DPH to fund community violence intervention groups in the state of Connecticut. And so those are some dollars that currently DPH is combing through and looking at ways to get those dollars out the door. But also, the governor also allocated, when you look at his American Rescue Plan allocations, he also allocated $875,000. Now, he allocated a lot of dollars in there. I don't need to tell many of you this on the line here, but on the panel. But I'll just point out a few areas, one of which is the $875,000 of ARP funds over 3 years to hire 2 additional staff that are also inside DPH, which is within the Office of Health Equity. And their role with those dollars is to provide an enhanced focus on racial disparities in public health. And this here could strengthen DPH's approach to understanding community violence and what can be done to address this issue. Also within DPH, there's a requirement here in Senate Bill 1, which is for DPH to study the state's COVID response and make recommendations for future communicable disease pandemics. When you think about violence prevention professionals in the state of Connecticut, a recent occurrence, and we've always had intervention specialists, crisis intervention specialists, but most recently in the last couple of years, we begin to train folks to become violence prevention professionals, and we have dozens of them now here in the state of Connecticut. And this here, as it relates to Section 10 of Senate Bill 1, is that VPPs in Connecticut were on the front lines during the pandemic, but also continue to provide support to families as it relates to COVID resources, meeting basic needs, et cetera. And so as DPH contemplates looking at the state's response to COVID, here too is an opportunity for them to include violence prevention professionals. But also within the governor's bill or the governor's plan, ARP allocation plan, he also references not only DPH, but DMIS, as well as other state departments that play a significant role and could be useful for the purposes of supporting a commission. And so in Section 5 of the Senate bill, DPH is also directed to study the development and implementation of a recruitment and retention program for healthcare workers in the state of Connecticut. Now, going back to, again, violence prevention professionals, if DPH is charged to looking at developing, not only to develop a study to develop the development and implementation of recruitment and retention of healthcare workers, violence prevention professionals are also healthcare workers. They're trained, they're certified, and in 2021, the state of Connecticut passed the bill that actually provides Medicaid to actually reimburse another resource, another funding opportunity to reimburse violence prevention professionals. And that bill was passed throughout both chambers of the House and signed by the governor in June of 2021. So here too is again an opportunity in DPH. Many of us are now working with DPH to make sure that that mandate is fulfilled in terms of certifying violence prevention professionals under the auspices of DPH in their role and their capacity regulatorily. The options here that we came up on in terms of the establishment of that commission is one, clearly looking at DPH as something for the legislature to consider, having a conversation with DPH and sticking this commission within that division of the state. But also it could be a standalone commission that could be staffed much like the Commission on Racial Equity and Public Health, also a part of Senate Bill 1 as well. And then there's another option, and there could be others, but then there's another option to actually reboot the Governor's Commission on Youth and Urban Gun Violence, which has been dormant since 2015. And this could be a way to also re-engage the advisory committee members who have played a role in producing the report that we are discussing today. And so really what we have here is three options, one within DPH, One is to establish a new standalone commission. Again, that can be staffed much like the Commission on Racial Equity and Public Health, but also it could be at least short-term to get the members that were part of this effort re-engaged. They may even be able to reboot this effort, possibly to get them re-engaged short-term, because as it stands, the advisory committee as of January 1, or when we submitted our report, we disbanded based on the way that we were basically our whole advisory committee disbanded the moment we sent this report to the joint standing committees. And so part of our charge was to take a look at 5 mandates. Mandate 1 called on us to consult with community outreach organizations, gun violence interventionists, researchers, public safety, law enforcement, as Pina indicated, and then to draw upon whether or not it was feasible and actionable to create that standing commission, which we just addressed. But also part of Mandate 1 was to look at bridging and recommending the bridging of bureaucratic silos and building of local trust so that we can, in fact, begin to engage or begin to support these kind of efforts with the full complement of state agencies, as well as members, again, of the former advisory committee, and even those that may not have been a part of the advisory committee. Mandate number 2 focused on proven best practices and calling on the advisory committee to identify effective evidence-based and community violence and gun violence reduction strategies. Typically, when you think about, say, the best practice models that are not only at play here in the state of Connecticut, but across the nation, 3 generally jumps off the screen: hospital-based violence intervention programs, group intervention or group violence intervention programs, and also violence interrupter programs, career violence model. Hospital HVIPs, currently there are 2 in operation right now. That's at Yale New Haven Hospital, along with one of their partners, the Connecticut Violence Intervention Group in New Haven. But also here in the city of Hartford, there's St. Francis Hospital, along with Hartford Communities That Care. And then there are emerging HVIPs in Bridgeport, but also a few as well here in the city of Hartford. And then when you look at the violence interrupter programs, these programs are primarily in Hartford, Bridgeport, and New Haven. And those are street level violence intervention programs, such as the ones that are operated by RISAP in Bridgeport, as well as, again, some of our Bridgeport, New Haven partners, and also here in the city of Hartford, Compass Youth Collaborative. But then when we think about group violence intervention program, what comes to mind here is really Project Longevity. So those 3 major models, are really the evidence-based, if you will, programs that have been around for some time that have proven their effectiveness, not only locally, but also nationally. But also what this mandate called for was also the training and technical assistance to make sure that interveners and that those that do this work are also properly trained as well as certified. And that's important in many respects because, one, we want to make sure that we begin to build the bench inside our communities. And again, not just Hartford, Bridgeport, New Haven, Stamford, Waterbury, New London, you name it, to where there are folks who are trained to do this work, certified to do this work. And 2 of the agencies or 2 of the training entities in the state of Connecticut that have actually can and have been doing this work, or the training, has been the Health Alliance for Violence Intervention, which is the HAVI, but also the Brother Cow Institute. And then this under mandate number 2 calls upon support for survivor services. What comes to mind here is when you think about some of the mothers groups across the state, Bridgeport, and You Are Not Alone, and there's another group down in Bridgeport as well. New Haven, I believe, also have mothers groups that also support victims of violent crime, families of violent crime and homicides, but also in the city of Hartford, you have Mothers United Against Violence. And here you have these mothers groups that actually provide those kind of services and support to make sure that families get the resources that they need. Okay. Another part of mandate number 2 was taking a look at the coordination between programs and services. And so as the state continues to contemplate exactly what needs to be done to support this work, we clearly are looking at coordination. And that's one of the reasons why we want to look at establishing an office. to make sure that these services are also coordinated between agencies, between programs, between you name it, but also equally as important is to make sure that we have the ability to evaluate the effectiveness of these programs. And then, of course, all of what we're looking at doing will be trauma informed based on best practice strategies and models and approaches. But then we look at what's commonly or not very common that people don't quite frankly draws people's attention to is really place-based strategies and coordinated events. And so you're thinking about, cleaning up vacant lots, green spaces, and so forth. We all know that when people feel good about their neighborhoods, they feel good about their homes, you generally see things that are upkept. When things are challenging to a community, you begin to see the decay, or when you have a lot of, say, economic deprivation in many communities, you begin to see that decay. But however, when you're able to build on and improve in these areas, that too has been shown to have not only a calming effect, but also a reduction of violent crime in many of those areas. And then, of course, there are other special events and activities when you think about plowshares and the work that they do across the state and across the nation to draw attention and raise awareness around violence. That too is also a promising strategy that also helps folks in their communities begin to understand the impact violence has and ways of which they can be engaged to address it. Mandate number 3 of the 5 is the identify strategies to align the resources of state agencies to reduce community violence. Here, the advisory committee recommends both targeted and competitive state grant programs. We all know and we all hear a whole lot about, and quite frankly, people are excited every time there's a competitive grant opportunity that takes place. But what's left out is actually opportunities to really target those resources towards entities that actually, sometimes in many cases, are the only individuals providing a particular type of service within that geographic area or that community. Or they're more effective based on the evidence that they're able to produce in terms of their effectiveness, and really to put some of these programs in a position to where they have to compete on something that they pretty much are on their own doing and they've demonstrated effectiveness. That's where both targeted funding, that's one example of how targeted funding can actually serve our purpose as well. And then, of course, we ask the state and our partners and all of us to examine which policy and funding approaches in Connecticut and other states present the most promising approaches to reduce violence. And then third, out of our mandate 3, is to make full use of currently administered grant programs, including Medicaid reimbursement that was mentioned earlier today. But also when you look at the ARP dollars, when you look at other federal funding that has come into many of our state agencies, really we can take a look at, and I'll give some examples of that when we, in fact, we don't have far to go if we look at the governor's allocation of ARP dollars. And we won't have far to go if we look at the city's allocations and the municipality allocations of grant funded dollars to see exactly where we might be able to find resources to support some of this work. And so here's an example, and this is part of mandate 4, which is to identify state, federal, private opportunities for community violence and gun violence reduction initiatives. ARP dollars, most recently, last couple of years, $350 billion have been allocated to both state, county, and cities. Executive actions by the president, who's actually allocated $10 billion or directed 5 federal agencies across 26 programs to put $10 billion out into the streets through a competitive grant-making process for programs or service or folks to apply for. Some of this stuff is around research, some of it is around direct programming, some of it is a range of different ways that people can begin to address this through those dollars. But also Medicaid, again, touching on that, the state of Connecticut was the first in the nation to actually get across the finish line to where we got a Medicaid bill signed specifically to address community violence intervention. That's what that CVI is, for those that may not know. But we were the first to get across the finish line for Medicaid to support community violence intervention programs. And that's also something that President Biden directed all Medicaid directors across the nation to begin to do as well. And then, of course, stuck inside my understanding, we're stuck, is those congressional earmarks. The state of Connecticut, our congressional leaders have allocated to our last count, 21 million that's been requested by our Congress members to address community violence intervention, to support community violence intervention strategies. To my understanding, it's tied up inside that Build Back Better bill, along with the $5 billion that's still languishing inside the Build Back Better bill. And so we're hoping that Congress can, and we believe that they should, continue to advocate to get both the Build Back Better and those earmarks to the communities, such as the ones that our folks here in the state of Connecticut rely upon. Most recently, in fact, just last year, also the Voca Fix Act was signed into law and put back in place. And here, forgive me, it says it increased from 0 to 75%. That's actually 60 to 75% of state compensation to crime victims. So during the previous administration, the Voca funds, they're actually not tax dollars. They're actually fines that are levied against corporations and others like pharmaceutical companies, if you will. And basically those are the dollars that actually fund the Victims of Crime Act. That's where those dollars come from, to fund Voca compensation programs. And so over the last administration, the Justice Department didn't prosecute and didn't go after many of those dollars, and it required Congress to pass what's called the Voca Fix Act to actually increase those dollars from a 60 to 75% to support programming. In fact, those dollars will start hitting probably in the next 2 years. We should begin to see those increases across the country, administered by our state, in our case, the state judicial department. 2022, President Biden directed $229 million through Department of Health and Human Services and DOJ through grants as well there. And then most locally here, when we talk about foundations, you have that have a history, and there are others that are not on here. But also when you think about the Connecticut Health Foundation, the Dalio Foundation, the Hartford Foundation for Public Giving, the James and Joanne Price Fund, Community Safety Fund, these are all private, if you will, foundations that actually have been supporting this work for quite some time in some cases, and most recently in other cases. And so, mandate number 5, develop a public and community engagement strategy for the Commission on Gun Violence Intervention and Prevention. You know, here we have several examples. I think there are maybe a dozen of them that the committee came up with. But this will require more work, quite frankly. Where once this commission is established, that's where, again, calling back and engaging the individuals who are part of this advisory committee and others will help us further flush out what could really be a very strategic and effective community public health and community engagement strategy for the commission to undertake. A few examples, again, you know, strengthen the ability to track crime prevention programs' effectiveness, place the responsibility for health and behavior problems on identifiable risk factors, not people. A lot of this is really just helping to change people's mindsets and elevate the importance of this work, what can be done, and how we should be addressing this issue. And of course, not to least mention that a strategy that speaks specifically around addressing the systemic community risk factors causing racial disparities in the juvenile justice system for Black and Brown youth and adults. This slide was already covered earlier in terms of recognition of our committee members, as well as special recognition to both Senator Moore and Stephen Hernandez, but also Peter touched on who our advisory members were. But also we have special acknowledgement to the individuals who actually appointed all of us to be on this advisory committee. Martin Looney, Senator Looney, Rep. Matt Ritter, Rep. Rojas, Duff, Catalero, Kevin Kelly, Jonathan Steinberg, and Mary Abrams. Each of these individuals were the appointing authorities of those that appointed those of us that served on this committee, and we're grateful for them recognizing the contributions that we can make. I think that's it for me right now. I'll stop share and come back to Senator Moore and Stephen Hernandez.
Thank you so much, Chairman Wood. This has been a real yeoman's effort, and I think the way in which you have described the condensed amount of time in which you had to conduct this analysis, but the thoughtfulness and thoroughness with which you conducted the analysis really shows a level of care that I think rises to the task. And now the task is before you, the leaders of the state of Connecticut. So I'm wondering if you have initial reflections on what you've seen, some of the data, some of the recommendations. Senator Moore, I see that you've unmuted.
Well, I just want to thank Andrew, very comprehensive and laid out, because the report is very long. And I actually asked my senators on the call to at least look at it. But this presentation was really put everything in a nutshell that we could see the bigger picture. I'm not going to ask any questions because I know where I want to get. I almost feel like I'm a scientist looking for a certain outcome. And I'm skewing the numbers on some of this to get what I think we need to do. So I'll be interested in hearing what the thoughts of my other legislators around here on this. You know, what I do want to say is this information was readily available because people are doing this work 24/7, right? All we had to do was go out and find it and put it together so everyone could see it in one place to understand what's going on in the state and what it is that people are looking to do and how do we be able to accomplish this. You know, this gun violence that's taking place is taking place in many other places also. But where I see people are most successful, I'm looking at New York City right now, where the police officers were shot and the little 11-month-old baby that turned a year old on her birthday and had been shot in the face while sitting in a car in New York. Unintended consequences of gunfire and youth running around with guns. He's putting together a really comprehensive plan on how to address this. And even though we have a lot of great initiatives in Connecticut and we have different sources of revenue coming in to do some of this work, it's not concentrated. It's not measured. It may be measured individually, but not on a bigger whole of how it's impacting our state. And so I go back to, we have all the information in front of us, and the information and the data will help us see what is going on here in Connecticut and how we address it. There's a lot of funding that's coming in, but I don't think it's coordinated. And I don't think there's a lot of requests for evaluation on what works, what doesn't work. And then I never want to leave out those community-based small programs who hit the ground running, right? Or who are evidence informed, but may not have been evaluated. Here's an opportunity to get some of those programs evaluated to see what works and replicate them in other places. So I know where my heart is, and I've already got an opinion very fixed on what I'd like to do. So I'm going to open it to everyone else to have their comments. And I do appreciate you all being here.
Thank you, Senator Moore. Senator Winfield and perhaps Representative Porter and Rep. Steinberg, you know, oftentimes what we see in communities in distress, particularly communities of color, is a triage response to violence and to incident. And we know that so much of this work is linked to prevention and intervention as a form of prevention. So I'm interested to hear about how it is that this report has framed your thoughts on the importance of coordination as an element of prevention and how you intend to proceed based on these recommendations.
I'm glad to start. I take Senator Moore's point that coordination is often a weak point of government. We see this a lot in the public health sector, where we have several agencies involved trying to take care of problems. We create silos that make our jobs much easier. So I'm really interested in the idea of finding ways to coordinate activities, highlight programs that we know are working in the community. Whether a top-down approach is the best answer, I think that it would, at the very least, create the kind of focus that we need as a state if we're going to actually bring about positive change. One of the other things I found very interesting in the recommendations, which are really quite thoughtful and comprehensive, is the point that suggests that we need to be able to measure violence prevention, which I imagine is a difficult thing to do. But having evidence is critically important for identifying those programs that we would choose to scale up on a statewide basis if we could, and making the case to other people that these are indeed programs that are highly effective. So I'm curious on how we can further pursue ways in which we can, first of all, take credit for successes, but more importantly, identify those programs that have actually made an impact in the community in a constructive fashion. It's hard to prove the absence of something, but yet that's critically important in this context.
Thank you.
I'll jump in at this point, I guess. So first, I want to thank you all for having me here and give a special thank you to Senator Moore. Senator Moore brought a lot of people together to really think about this issue and to, I guess, issue the clarion call to make sure that we were making sure that programs like Andrews and others really got the attention that they deserve, because that has not been the case. And I want to take you back for a second to right after Sandy Hook, and we created a group to look at the issue of gun violence. And you may remember that group was talking about gun violence in a particular way that largely excluded the kind of regular, everyday, unfortunately, everyday gun violence that we see in the state of Connecticut. That urban gun violence that builds those numbers into the statistics that are in your report. And I showed up at the hearing and I started talking about the story of a young man whose cousin had been keeping him off the street. And then his cousin got killed and his life fell apart. And the interesting thing about that was I was told that I was off topic, but this is the gun violence we see every day. This is the gun violence that takes, those, depending on the year, 85, 70, whatever the number is, young people away from us. And I was told I was off topic. And so our focus has not been on the gun violence that exists in the state. Senator Moore said there are unintended consequences. I choose to think of it as consequences that are very much intentional, because our policy prescriptions don't intend to deal with the violence that exists in our state. So you asked me the question about coordination and where do I see it? I see it as critical. But what I also hope happens after you make your recommendations and we do create a group, a commission, whatever we ultimately call it, is that we really start talking about making sure the programs that you have are effective, the programs that you have are coordinated, but we also talk about those social conditions beyond your programs that are not really ever focused on. Safe communities don't require the level of policing that certain communities in the state and other states require. There's a reason for that. It is because of those social conditions, the access to employment, what happens in the education system, and all of those things. So I see this as hopefully a really good start to a very robust conversation that has already been going on, but it never really caught the steam that it should, because people were focused on band-aiding this and doing it in the silos, and we really need to end that. So that's where I begin.
Thank you, Senator. I love the interplay between what you said, which is understanding root causes and understanding community, and what you said, Representative Steinberg, which is you can't track the absence of gun violence, but you can track the existence of hunger insecurity, food insecurity, urban trauma, all of the other issues that our communities are facing that is causing the type of despair that is resulting in gun violence. So I thank you both for your thoughtfulness. Representative Porter.
Thank you, Steve. And I just want to first also thank Senator Moore for championing this and leading on a very pressing issue. And I think that we all know the pandemic has exacerbated what we're seeing in communities that are suffering from extreme gun violence now. And I do want to thank everyone, and Mr. Woods, Dr. Violano, you, Stephen, TJ, everyone that had a hand on this plow, because this work is so much needed and overdue. I have to agree with everything that's been said so far. And the things that really resonated with me as you went through the report was, more jobs and summer jobs for youth. When we talk about root causes and we talk about what's missing, the resources that are lacking, we often talk about, an achievement gap when we know it's an opportunity and resource gap. So we have to find conductive things for these young people to be doing to keep them off the streets, keep them off the corners, keep them from being engaged with gangs and street violence and crime. And we have to invest in them in ways that say to them, they matter. So I thought that was really important. And absolutely the talk and conversation has been going on around coordination between programs and services, the fact that we need trauma-informed care. It's just like when we talk about being culturally competent, that's the way I see that. You can't assist people, treat people with trauma unless you've been informed or you've been traumatized yourself. I think that lived experience goes a long way. So I'm hoping that that comes in as a component when we start talking about trauma-informed care and who's providing that care, how relatable they are to the population that they're helping. Do they look like that population? I think all those things are important, and absolutely around place-based strategies and coordinated events. And when we talk about economic depravity, it hits home. I think all these problems are rooted and grounded in, economic injustices in the communities that are suffering from gun violence and many other things that come from this. It's intersectional. So bottom up, buy-in, the first thing I thought about was foundation. You don't build the house from the root down. You don't start at the top and build down. You start at a foundation and you build up. And I think that's the thing that we have to do. We have to change how our mindset and how we see solving this problem. And we absolutely have to make sure that those closest to the problems continue to be, at the table so they can assist us in the solutions that we are coming up with. And I love the fact that, we get to talk about Andrew's programs like Lineage Jihad's down here in New Haven, Connecticut VIP, and the work that they do hands-on. It goes a long way, and I've seen the effects of it. It really does turn some of these youth around. Do we lose some? Absolutely. But my thing is, if we can save one, we've done a stupendous job. So I just want to say thank you again to you all for putting, just grinding on this issue and making sure that what we're coming up with will be something that's effective and efficient, and that we're not just talking, but we're actually walking. And I do thank you again, Senator Moore, for leading on this. The time is now. Thank you, Stephen.
Senator Moore, it strikes me, or it should be no surprise to our viewers or to even anyone on this panel, that the leadership that is expressed here today, right? Leaders from New Haven, leaders from Bridgeport, we're seeing that 70% of Connecticut violent deaths between 2015 and 2021 were in Bridgeport, New Haven, and Hartford. Senator Moore, how do we ensure that those resources that are coming either from the federal government, that are being attributed by this governor, get to the place where they need to be the most, which is on the ground where the violence is happening and where the need is?
Thanks, Stephen. I want to thank all of you all for your comments. You're right on with them. When people talk about the ARPA funds and the dollars that are coming in, they're just numbers, and people are seeing it as a lot of money, and it is a lot of money. But what I don't see is that coordination of how that money is being spent, right? That we're not just handing out money to people, and everyone has to do evaluation at some point. But is the money going in the places where it's needed the most? Those ARPA dollars. And those ARPA dollars are short term. They're not going to last forever. How do we leverage those new dollars to get us started and try some things? Representative Porter mentioned doing things differently. The world that we lived in 2019 is gone, not coming back. We've used 2020 as a place to learn and say we need to invent some new things. There needs to be different ways of looking at how we do business. And I think this is an opportunity with dollars to do something different and do it the right way in a coordinated effort that everybody in the state knows what's going on. I'm going to be honest with you and tell you, I did not know about the work that was being done in many parts of the state for gun violence, right? I knew what was going on here. It wasn't until Andrew contacted me and told me about the hobby that I learned the bigger picture of how many people are doing that. But as a legislator, I want to know, when I say yes to dollars, are those dollars going in the place where they're most needed? The only way we're going to find that out is that it falls in one place where people are looking at it, evaluating it, getting feedback, understanding what the needs are. And I think we have fiscal responsibility. We should have been doing that anyway, as Representative Steinberg said, we should have been doing this. I mean, when you talk about working in silos, what really gets done if we're not working together? And this is an opportunity for us to get that done.
Thank you so much, Senator. And, you know, this is a short session, and it's a concentrated session in which we're going to be focusing on the issues of utmost importance. And I'm wondering whether any of you feel that this is a session in which you're going to take this head on. Some of these recommendations, as Chairman Wood said, some of them are lower hanging fruit. Some of them are things that can be accomplished within the next few months, that coordination can start. Do you anticipate that you are going to have, or at least see, some legislative movement this session on some of these recommendations?
I'm hoping that we can introduce this through public health, and maybe it may need to go to judiciary. But I think at the frame we've built, we have the information, we've done the research. I think what we need to do in this session is agree or disagree that there needs to be one place, this commission or whatever it's called, to begin the process to carry out all those other mandates that are within that bill. It has to come in one place, and it has to have someone over to be responsible for it to make sure these things are happening. I don't think we could just leave it to one person's going to do one thing and somebody's going to do something else. There has to be someone who's going to be coordinating this information and putting this together and continuing to build on it, right? And putting some dollars, I want to be transparent. I had put in $5 million in 1 year and 7 in the next in the bonding commission to try and move this. I was really trying to get leverage to move this to get it done. The governor put out, I think, $3 million from ARPA funds, but $3 million, when you look at the whole state, $1 million, or either 1.5 and 1.5, is really not going to do what we need to do. And we're not trying to put a Band-Aid on this, as Robin said. We are really trying to address this in a comprehensive way that we can build a roadmap for the future on how we're going to deal with this gun violence. And as we on this journey, we move the needle and we stop and say, okay, this didn't work. We evaluate what works, what doesn't. We come back to the table, and that takes dedicated resources to do that. And I'm hoping that I can put forth a bill to get us on that path, to at least establish the commission, and then let that commission start to work to get us where we need to be. I'm also hoping that we can keep that advisory committee who works so hard on this, who works in the community, as a part of that commission. Not sure how, but I don't want to lose that knowledge and the work of the people who helped us get to this place, put that information together, who are doing the work on a daily basis.
Thank you, Senator. Oh, go ahead, please.
Yeah, I was just going to respond to it as well. I think if this report is issued, we go through this session and we don't deal with the things in this report, there's a problem in the legislature. Whether it ultimately gets signed or not is a different question, and whether or not the legislature endeavors to move forward on this issue. And I think what I hope also happens is we focus on, we focus on the question of what works versus what doesn't, that Maryland Senator Moore brought up here, because, you know, as I listen to all of this, I think to have these programs work, be effective, be coordinated is exactly what we need to be doing. But we also need to imagine something different than what we're even talking about here. And that is communities where you don't need to have people intervening, because the level of violence is not what we currently understand and see in our communities. And that would call into question a lot of different things for the legislature to be dealing with, right? Some of the stuff that we talked about those root causes. And I think the opportunity exists to have that conversation inside of this conversation. Because there are communities where you don't need to have violence intervention, right? Because they have the things they need. The resources are not, well, we need X number of $1 million so that people can come and have trauma-informed care, because trauma is dealt with in a different way, because the communities are engaged in a different way. In our communities, what you have as the intervention are police or people who have decided that there's enough and we're going to create our own program that eventually can potentially grow into something like what Andrew Woods and others have. But that's not the way to really get this done. The way to really get this done is to imagine a community that's a completely different community, think about what those communities need, and then put the work behind that to make sure that the state is responsive to it. And that's a lot of money, yes. But with spending, what does the report say? $430 million down the drain for not doing it? That's a lot of money as well. So from my perspective, yes, I don't know where we wind up, but absolutely the legislature needs to be responsive to this report and do something about it by putting forward a bill. And, listen, you let me know, I'm signing on to it. I'm sure Robin's signing on to it. And I'm sure many of our colleagues will sign on to it to make a push. And if we don't get it, then the next year we do it. So.
I totally agree. We have to continue the conversation. It happens in silos. This is, the first leg of the journey. The next leg of the journey is bringing it to the legislature. I mean, when we think about the lack of opportunities and resources, the root causes, the thing that fuels the belly of this beast called, gun violence and gang violence, is actually something that can be fixed. And Senator Winfield said it well. I think of it as just looking at communities that don't suffer from this and doing an overlay. Just give me what they have, the resources, the opportunities, state of art this, no digital divide, jobs, livable, sustainable wages, good education. We have a whole lot of substandard things going on in communities that are suffering from this kind of violence. And what this pandemic has done is exacerbated what we're seeing. People are like, oh my God, what is going on? What do you mean what's going on? People are not at work. This is the highest unemployment rate we've had. We haven't seen numbers like this since the Great Depression. And we have, women that can't return to work, who are the majority of the folks that got laid off or were forced to leave work because they didn't have childcare. They had to take care of their children. That hasn't changed. So there's so many things that need to be addressed. And if we don't address this, we never get to the rest of that. And it is like, putting a Band-Aid on a gaping wound. And it's just time for us to do this, the surgery, the surgery that's required and needed to make this repair. And it has been intentional. Let's be real about that. It has been intentional and it has been malicious. That is part of the root cause. It's the systemic and structural racism that we're dealing with. That's the other thing that has to be addressed. So I don't see how it doesn't come back to the legislature, how we don't do a bill. And, it's not about, yes, I would love to see it pass. But I think what's most important right now for the next leg of this journey is to continue the conversation, educate the public, educate the General Assembly, educate everyone that touches this, because we all have a role to play and we need to make well-informed decisions, and we can't do it without the work that you all have done up to this point. So thank you again.
Thank you, Representative. Chairman Woods, your reflections?
Well, one, I appreciate each of your reflections, as well as your commitment to advancing this agenda to get this work done. It's heartwarming. It's well overdue. I know that each of you have been fighting the good fight on multiple different levels, on multiple different issues, and it's never as easy as people think it is in terms of the work that's always put before our lawmakers. And so I appreciate your efforts on, again, a lot of the things that you're fighting for in the different constituency groups that are pulling on. I would say this, three things that we as members that do this work would love to see, and really in many respects demand to see, quite frankly, where we would need your leadership and your advocacy, is that money now. Number one is money now. When we comb through what we've combed through, and we see the kind of resources that have been already allocated currently. And again, going back to even the ARPA dollars and going back to other federal funding streams that have come into the state that are currently parked at an OPM that's currently parked, and some of our state departments currently parked under the governor's thumb, is that we really don't see a reason why dollars can't be shaken down to help us stand a better chance at dealing with this issue from a prevention, intervention, and recovery standpoint in the state of Connecticut. This commission and what we're proposing here is going to be, as you know, a process to get there. Whether it takes place come July 1, it's signed into law, if you will, or it's created by then, or it takes place in 2023, it's still going to be a process. But there are folks out here that we see on a daily basis, and quite frankly, multiples of times during the day, who are being victimized and in need of these services and supports, and individuals who we can intervene with to where they do not become victims of violent crime in our major cities and across the state of Connecticut. But the resources, folks, that are allocated towards those of us who have been proven to be effective in some of the work that we're doing is lacking significantly. And so we do ask that you and your colleagues take a look at and demand as well that more than $3 million get shaken down to be allocated towards some of these groups that are doing some of this work, so that they can, while we're thinking through the processes, continue to provide the support to our communities. The second thing was the commission is a process. The third thing is that when we look at the uniqueness or the opportunity that's with us today, or related to Senate Bill 1 and the Commission on Racial Equity and Public Health, I don't think Senator Moore, there probably couldn't have been a better place to at least to start this conversation in terms of the work that we're undertaking. Under Senate Bill 1, it has the intersections between what, even to Gary Winfield and Ms. Porter's point around root causes, that equity bill, that equity commission actually examines many of those issues and looks at ways to examine policy, practices, resources that can bear to addressing disparities that actually put our families and communities at risk. And that's why, for me, as a person who's been doing this work for years, it's never been a one-sided, it's never been even a two-sided coin. It's always been a very complicated issue related to gun violence and violence in general. And it's always impacted on, I always saw the connection between economics, between education, between racism, between, you name it, you pick it. You can see those correlations and connections on why people are responding and engaging with each other in ways that are detrimental to others. And so as we move forward, I would also encourage that these efforts be methodically, if you will, or strategically blended into, on some level, that Commission on Racial Equity and Public Health. And so if there's another seat at that table or two, then folks who have worked on this plan need to be at that table. They need to be also educating that commission on exactly what this looks like in the state of Connecticut, and to learn from those that are on this commission on how we can all mutually address this issue. But it should not be left just up to those of us that do this work to have to sort through that. And for us to even think we can sort through that is arrogant. Trust me. And so we need to be thinking along the lines of how other people view this issue and how we can all mutually come to a way of addressing violence in the state of Connecticut. I'll leave it there, folks.
Thank you, Chairman Woods. you know, it's striking to me, there are only so many ways that you can connect the dots before you see the constellation that we've been trying to show you for generations now, which is that the legacy of exclusion and the legacy of oppression is alive and well. And unless we keep connecting those dots in terms of food insecurity, hunger insecurity, lack of resource, lack of investment, then all we're doing is nibbling away at those edges that you described. So I appreciate that drawing together, Chairman Woods, really continuing to connect all of the different ills that plague communities intergenerationally. And the approach has to be coordinated. And that's why the main recommendation here, which is to coordinate efforts and to look outside of the incident of the gun violence itself, but to look beyond the moment of the gun violence at all the other ways in which communities are impacted. That is really the story to be told here today. Dr. Violano, I see that you have unmuted.
Thank you, Andrew. You couldn't have said it any better than that. And the piece that I'd like to add is that we have to make sure that we keep the folks that are the closest or being affected by this problem totally in sync with us here and not exclude them. You know, I would even recommend that there be a youth at some point you know, on this commission on you know, giving us advice. I mean, they have told us time and time again what are the problems and how to fix the solutions. You know, Representative Porter, you know, your letter that you submitted in the program that you attended, I mean, those kids told you exactly what they needed and what they want us to do. We have to listen to them. I mean, as a nurse and working in a trauma center, level 1 trauma center for years, we've seen the same kids come in and out and be affected, and families and generations of families being affected by gun violence. It has to stop. I mean, they've been telling us what we need. You know, you've hit on all the points there, Andrew, on it. If we don't connect these dots and we don't pull this together, we're not going to make a difference. We're not going to move the needle. And then the other piece I'd like to say, you know, and I've addressed this before, there has to be the right measurements there, the metrics that we need to use to evaluate programs. Being a researcher myself, and that it's not always about the academic sides. We have to look at those little mom and pop organizations that are out there, or what we're, you know, calling evidence informed. They're doing the right things. They just don't know how to tell us that they're making an effect in our community. Those of us that know how to do this work have to help them put that together and give them the metrics and help them evaluate these programs. And we have to include that on that. And those are just the pieces. It's not all about academics. Yes, we can write papers. I've published, I've done all that. It's not about that. You know, I've walked the street, I've gone in there, you hear it live, and I've lived in the neighborhoods where the gun violence been affected. It's powerful. And when you hear where kids can't go to school because there's a yellow line up and there's blood on the sidewalk in front of them and they can't get out of their homes to get the education, we have to address those issues. And those are just the comments that, you know, I just want to make sure that we keep at the forefront, and yes, and not to you know, make light of any of the gun violence that's happened for Sandy Hook and that, but we're talking very different animal here of gun violence in an urban setting, and the issues where there's not economics and resources available to help our communities. So.
Thank you, Dr. Violano. Senator Moore.
Thank you, Dr. Villano, for that. Because, you know, I know that Representative Porter had worked with youth in this, and I think that is a voice that's really, when I look at the hierarchy, I think they're the most important voice, because they're on the ground and they're involved in it and they're seeing it and they understand the reasons why some of this is taking place. And I think as we move forward, we need to do more with the youth to help understand what they're going through and what it is that what do they see as what would be their recommendations on how we address this. I think that has to be brought in also. And then, you know, I think all of these comments, I think we all get it. I think we all get it. And I think we all understand that we need to do better than what we're doing. And there needs to be this concerted effort to do it. So I feel as though it is something that we could work on in this very short session, because I was thinking about when Robin said, Representative Porter said about, you know, that trauma doesn't begin when they get the gun. The trauma begins long before that on all the things that we don't have in our community to support them. But I also believe that if the community could see that we are doing this with the intent of making it better and including everybody, I think people would start to have a little bit more hope. Our youth would start to believe that we're paying attention to them and trying to do the best we can for them by including them, by listening to them and engaging their parents, who are also many times suffering because they don't know what to do with their youth when they know that they're angry or they have a gun. Where are they going to send them? I think this is a huge undertaking, huge. If we're really going to do what Senator Winfield said about really creating something different and approaching the trauma and all the things that we're going through in this time right now, that this is really like a strategic plan for the next 10 years. What are we going to do to address this? Right? It's not going to be addressed in year one. It's not going to be in year two, but it's a long-term plan engaging public health, social services, DCF, engaging all those different communities that deal with public health and Department of Justice, all of us working together to figure out what is this plan that we're going to carry forward. I know when the governor started, he when he was first elected, he brought many of the commissions together so they could work together. And even on the commission that he put together for women and girls, it was about bringing all those agencies together so they could see what they're doing and how do they work together to come to a product that helps everybody that's coordinated. That's what we're trying to do right here. We're trying to bring the people to the table to work together, to get them the funding, to evaluate. I know as a small nonprofit, I wish I had someone like Dr. Villano to help me evaluate the work in my early days. I got lucky, and I met a Yale researcher who did help me get to where I need to be. So I could go and get future funding to sustain the organization. But a lot of small nonprofits don't have that, and they're doing good work, but they don't have the resources or the know-how on how to do that work. So I want to make sure for all the things we need to do that we're inclusive, thinking about all those things, because it's not one thing that's going to settle this. It's going to be all of us working together with many ideas and different plans at different sections and crossroads on what we do to move this forward. But I'm hopeful. I'm very hopeful.
I just want to
Thank you for that, Senator. Go ahead, Dr. Villano.
Yeah, I just want to add, and I think what this commission can do, and what one of the roadblocks we found is, to find out what people are doing and how to, if we had a central repository for all of these efforts, it would be so helpful, so that even the duplication of work and just sharing of, what best practices are in these communities would be so helpful. I mean, we found it because, I've done the work for years, as Andrew has done it. But again, it's just, how do we get where everybody knows what everybody's doing in the state, so that we're not all, in these silos, which we do so well. But, to get those coordinated efforts, I think we really even need to know what is out there and what everybody's doing. And I think we've done a great job of trying to pull that together. But I'm sure we've missed, one or two out there that we, again, with the 90-day window that we had, we've gotten, I think, 99.9% of what I think is out there. But it's almost, if we can find a place where everybody has to kind of register or just, let us know what you're doing there. Would, I think, be very helpful as well.
I just wanted to, thank you, Stephen. I just wanted to kind of add to what Dr. Villano had started talking about around, the kids that I was with. And I remember it was all males and there was one female. And she said something that has resonated with me to this day, and it will resonate with me for the rest of my life, because as much as you do the work, as much as I've been, impacted myself by urban trauma, it's a different generation, and it's a different thing going on out there in those streets. And, I was listening to them, and then we started talking about, the solutions and what they were proposing. And I said, we really want to leave room for you all, a safe space where we can kind of like be a hedge of protection, allow you the room you need to move and figure things out. And if you, veer off a little bit, we're here, like a safety net to lead and guide when needed. And she looked at me and she was like, a safe space, a hedge of protection. She was like, what are you talking about? She said, you know what we're living right now? This is our normal life. We don't know anything else. So when we're talking to them, and I was taken aback. I was like, wow. And then I had to just sit in it. And she was right. Because as much as we think we know, until we really, and I mean really, hear what these young people who are out here living in this fear and dealing with this violence day in and day out, we're going to just be doing what we're doing right now. Like she described it as, this is our normal life. It's been normalized for us. And then, Senator Winfield was talking about, and I absolutely agree, we have to give them a vision that's greater than where they're sitting, because there is no vision. There are no dreams. We talk about the American dream. In my community, it's like the American nightmare. They can't even visualize what the American dream looks like. And this is where partnerships are important. I really hope that we get to a point where we're talking about, these children being taken from this community to communities like Easton and Cheshire. And I mean, I've been all over this state, beautiful state, lots of land, horses. I mean, like, it's all here in Connecticut. I grew up in New York. I used to have to go down south to get that kind of experience. Right here in Connecticut, we have it all in Connecticut, from the urban to the suburban to the rural. I mean, this state is awesome. And the kids in these urban centers who are being impacted by this violence need to see that, so that they have a gauge that's different than the normal gauge. And they have something to compare, something to work towards, something to inspire for, to be incentivized. Like, where's the payoff? And what does it look like? And how do I get there? So I just wanted to bring that to the conversation as well, because I'll always harp on the fact that, the people closest to the problems, and they are on the ground living this thing day in and day out. And we need to make sure that not only are we listening to them and that we hear them, but we actually implement what it is they're telling us needs to be done. We have power. Our job is to empower them.
Thank you, Representative. As we come to the conclusion of our time together, I just want to reflect on the fact that, so much of what each of you has said, including from the guidance that led to the creation of this task force, to the chairing and administration of this work, and now your reflections today, is really clearly based on a love for community and a real vision for what could be different. And it's that vision that you noted, Robin, is missing from our young people, because they haven't experienced yet the gift of being able to see the possibility of that difference. So I want to thank you, each and every one of you, for allowing a glimpse into what the world could be like for our communities if the social determinants of success were something that they had access to every day. So with that, I want to thank you again for all of the work that you did, Chairman Woods, Dr. Violano, and TJ Nuccio, in administering and chairing this work. And then, of course, Representative Steinberg, Representative Porter, Senator Winfield, and Senator Moore for your continuing leadership in this work. This work is not by any means done, but as you know, the more that you connect the dots for other leaders in the state, the more they will see that by overlaying our investment, we will overlay our success. So thank you all so much, and we'll keep talking.